You may be aware that we only have one resolution going forward to the annual meeting this year in June, and the resolution is as follows. Bystanders can be lifesavers. And I'll just give you the wording of the resolution, which is, there are over 30,000 out-of-hospital cardiac arrests a year in the UK, and less than 1 in 10 people survive. Women have a lower chance of surviving than men. Early cardiopulmonary resuscitation, which we probably know now better as CPR, and defibrillating can more than double the chances of survival. We call on WI members to work together to increase public confidence and training in the delivery of CPR, and to work with local organisations to help to improve access to defibrillators in their communities, to give every person the best chance of surviving a cardiac arrest. Since the annual meeting resolution was announced, WI members have had the opportunity to learn more about the issue and to discuss the resolution in your WIs before deciding how your link delegate should vote at the virtual annual meeting. Since the annual meeting resolution was announced, WI members have had the opportunity to learn more about the issue and to discuss the resolution in your WIs, although I realise some of you will be doing that next month. And that's before you decide how your link delegate should vote at the virtual annual meeting. WIs and federations have also been encouraged to hold discussion events to allow members to consider how they wish their delegate to vote. The aim of this discussion today is to aid this process and help you to decide how you wish your delegate to vote. Arguments for and against the resolution will not be presented at this supplementary meeting, and no voting will take place. It is intended as a supplementary opportunity to meetings and events organised by federations and WIs in advance of the annual meeting, so we would encourage you to continue to offer these to support members in deciding how they wish their delegate to vote. Please do put your question in the chat, and we will aim to get to as many of them as possible in the Q&A. And now we come to the exciting time, because I'm just about to introduce Vicky Selleck, who is the Chief Experience Officer at St John's Ambulance. We're very lucky to have her here with us this morning, as she's just come hot foot back from her holidays, so we're even more honoured. And she is responsible for the strategic leadership of the fundraising, external communications, adult and youth volunteer teams. Vicky provides senior strategic leadership across these teams to deliver a shared experience for all of our people, supporters and customers, to inspire a deeper connection to St John's Ambulance mission and values. She also spends a lot of time working to empower young people in her volunteer roles as a youth worker and sailing instructor, and is also a first aid event volunteer for St John's Ambulance. She's a very busy lady then, isn't she? We have allocated a half an hour for Vicky's presentation, and I'm going to hand over now to Vicky, and I will mute myself, Vicky. So over to you.
Thank you, Chrissy. Thank you for the warm welcome, and thank you so much for inviting us to be with you. We were really excited to hear about this resolution, the way it's worked its way through your organisation. It's already started conversations locally. As you might imagine, early CPR and life-saving techniques and the distribution of defibrillators are issues that are very close to our heart at St John Ambulance. So, as Chrissy explained, I'm one of the paid members of staff at St John, and I am, sorry, I'm looking at the chat suddenly and saying things about audio, but I think you can hear me. Yes, good. So as you say, I do lots of work behind the scenes, essentially to help our volunteers do the brilliant things that they do in public. And so I say from the beginning that I am not a clinical expert. Rather, my expertise are in how do we build coalitions and activate movements and build work together locally. And so I will happily defer and refer you to colleagues with much more clinical expertise if we come on to kind of technical questions. But you'll know, I'm sure, St John Ambulance in its guise. It's been around for many years, perhaps the last 150 most recognisable to who we are today, a little bit like the WI. We are vested in local communities around England, and our mission is to ensure that community first aid saves lives. And we do that in two different ways. The first is by responding ourselves, and so we train 20,000 volunteers, each of whom will don a uniform themselves and go and respond to public first aid emergencies where they are most likely to occur. So that is often where people are congregated together, might be the local village fete, might be a festival happening. It's often where alcohol and drugs are involved. So we'll be around at the Notting Hill Carnival, we'll be around where people might be, you know, at Twickenham at the rugby this weekend, where people might be consuming a little bit too much alcohol. And it is often where people are putting their bodies through extreme stress. So again, we'll be at the London Marathon in 2 weeks' time, able to help and provide support so that the burden of first aid doesn't just fall on the NHS. That's not all we do. We also educate the public. We try and pass on our skills, because the reality is, unfortunately, you're most likely to be injured or to witness a cardiac event when we're not around. It's most likely to happen in your own home or in your workplace or in your children's school. And so it's really important that you, your family and your neighbours know what to do. And so most of our effort and most of our work is on passing those skills on. We educate 10,000 young people who come to our weekly clubs each year. We pass on life-saving skills to 250,000 people each year in the hope that their confidence means they will know what to do in a crisis. And that's what we're going to talk about today. So I've got a couple of slides to share to talk a little bit, to give you a quick précis of the sort of information on why is this an issue, which, as Chrissy described, I think you've already started to talk about locally, and what does it mean to you? And then share some ideas of how you might bring action to life over the next year if this resolution is passed. And they are just ideas, but I hope they'll stimulate your thinking and give you opportunity to think about how you might work with us and other organisations in your local community to make sure we reach many, many more people. So let me share some slides with you now. Chrissy, give me a nod if you can see those. Yes, good, great. Okay, so how do we go from bystanders, people who simply watching, to lifesavers, people who choose to step in and to do something useful in the chain of survival? So we're going to talk a little bit about what the issue is, what we've done to make a difference, and how we might work together in the future to make change happen. Well, as Chrissy says, unfortunately, cardiac events, that means something that's happening to do with your heart, unfortunately do affect lots of people in England each year. So there's about 30,000 cardiac events which happen outside of hospital, so in a community setting each year. And sadly, from those, at the moment, just 10% of people survive. But if you've done any sort of first aid training in the past, you'll know that early intervention makes a real difference. And early intervention means three things. First of all, early calling of 999. So really important to activate the ambulance service. Early CPR, so early pumping of the heart by someone who's just around and nearby, but getting that circulation started is vital. And early defibrillation, where it's available, getting one of those external defibrillation devices that you often see in public boxes, attaching them to the chest and following instructions. Each of those three things make a real difference. In particular, CPR and early defibrillation can make a difference, doubling someone's chance of survival, and particularly where defibrillators are activated early, particularly in the first 3 minutes, it can increase that survival rate by even more than 50%, by 70%. So really, really important to act. And yet we know that only 30% of people know what to do, and just 40% of those know how to use a defibrillator specifically. So if we're going to improve people's survival rates, then it's really important that we build everybody's confidence in knowing what to do, not just those people who feel like they're trained first aiders who are at an event or operating in your street. The second part of this problem is that it's also a gendered issue. Now, we did some research last year that showed that a third of people across the UK feel afraid of giving CPR to a woman. So if they do know what to do, if they do have any confidence to act, even then they're still worried about doing that to women. And particularly that is about being nervous of being accused of touching someone's breasts, of perhaps opening up their clothing to attach a defibrillator or to start resuscitation. People are worried of what they might be accused of. And when we tell them that it's really important, defibrillator pads don't work if you stick them onto people's clothing. You do have to cut away their clothing. And perhaps that might mean cutting through a bra. As soon as we give them that information, actually people's fear and concern expands again. And particularly 48% of men then say, well, there's just no way I'd want to act or do anything about this. The other part of this gendered issue is that the public are a little bit less likely to recognise the signs and symptoms of a cardiac event in women compared to men. Traditionally, people think of heart attacks, which are just one type of cardiac event, but they think of heart attacks in older men and they recognise the signs and symptoms for that, but less so for women, less so for younger people. And so people's health concerns might be more likely to be dismissed or to be thought of as something less vital than needing an urgent 999 call. So for all of those reasons, unfortunately, women have poorer health outcomes when it comes to a cardiac event. But good news is we know that training can make a massive difference to this. So in that same survey, when we asked people, well, if you had some training, if you'd ever been through this scenario before, if you'd perhaps seen a female mannequin or a mannequin with breasts, if you perhaps thought about how you would attach a defibrillator, if you'd had someone say that doing anything is almost certainly going to be better than doing nothing, if you'd had any confidence given to you, then you would feel much more comfortable in acting. So 64% of people say that given a bit of training and a bit of specific information, particularly about how to help women, they would feel much more confident in acting. So good news that something can be done about it. And again, if we're going to increase survival rates, really important that we focus in on people's confidence to treat women specifically. And the third thing, just to sort of say, as we think about the issue as a whole, is that, of course, defibrillation is really, really important. You will have seen these yellow public access defibrillator boxes, often on the side of church halls or schools, etc. There are around 200,000 defibrillators in the UK, which are outside of hospital. And most of these are public access. So they'll be in a box and you'll be able to open them if you have called the emergency services. But some of them are still hidden. Some of them are in dentists because they do lots of work with anaesthetics. Some of them are behind private doors. Some of them are in areas that the public can't access. Some of them are in schools which are only available if the gates are open in term time between 9 and 3. And so it's really important that we think about increasing the number of defibrillators, but also increasing the number of defibrillators that are easy to access. We work with a number of other resuscitation charities around the UK to maintain something called the Circuit. It's an online app and a map which shows people where defibrillators are. And it's something that NHS trusts use as well. So if you call a 999 call in, then the dispatch officer that's dealing with you can often tell you where the nearest defibrillator is using this map. One other challenge with defibrillators, because actually they're relatively easy to use, even if you haven't had lots of training. When you open them up, immediately it starts talking to you. There's a very easy diagram about where to put the pads. It will not provide an electrical shock unless those pads are in the right place and the rhythm is being tracked in the heart. So you can't do it wrong, but of course people don't feel confident in knowing that. And so, you know, really, really important that people have access to them. But one of the other issues is that you're much more likely to have defibrillators around you if you live in a wealthier community, and you're much more likely to have them nearby if you're living in an urban setting. If you're living in a rural or semi-rural location, well, there might be one in the centre of the village, but there's unlikely to be one on those exterior roads that come out from it. And if you live in some of our poorest communities around the UK, sadly, you are very much less likely to have a defibrillator on one of these public buildings that your friends could access to help you. So we know that access to defibrillators, to public access to defibrillators, is also an issue. And again, if we're going to increase survival rates, it's really vital to increase the number of AEDs available. So 3 parts, I think, to the issue. Firstly, that cardiac events do happen and we need everybody to know what to do for all people. Secondly, that sadly, women are less likely to be recognised and treated. And so we need to increase the public's confidence to do something for women when they see that event happening in front of them. And thirdly, really important, defibrillation does make a massive difference to survival rates. And so vital that we increase the number of defibrillators that people can access. So that's the issue. Is it possible to do something about it? Well, you'll have heard already, I've talked a little bit about some of the things we can do. We know it is possible to train people in very basic life-saving skills in 5 or 10 minutes. And so actually during Save a Life September, many of our volunteers got around into their local community. They trained 25,000 people during September to know the 3 basic ways to save a life, which includes CPR, as well as dealing with a choking hazard and major traumatic bleeding. We can teach you that really quickly and really simply. We can also join in with other charities. There was an International Restart a Heart Day in October. Again, 15,000 people educated in the very simple ways to restart a heart with very little long-term training. So it is possible, and there are these big moments in the year when we go out and deliberately try to pass those skills on to the public. It's also possible to raise the public's awareness about doing something specifically for women. And last year we ran a very successful campaign called the CPR bra. So we had these bras manufactured to show that actually it is okay. If I am dying, I really am okay with you intervening, with you potentially removing my clothing. And a number of celebrities, lots of social media influencers got involved to say, actually, they were really shocked when they learnt that women were much less likely to receive an intervention from the member of the public than men. And they wanted the public to know about it, wanted to do something about it. One of these women, the lady second in, is Millie Bright. She's the Chelsea captain, women's footballer. I know you've done lots of work with Chelsea in the past as well. And that she, particularly having seen cardiac events happen, not only on the pitch, but also in the stands at football matches, appreciates that early intervention of life-saving support. And she was astounded when we told her that she was far less likely to receive treatment as a woman than she would be as a man. It feels like something we ought to be doing something about. And so it is possible to galvanise the media to respond and to activate and to put out this information to other people. And again, we saw a real difference in the number of women signing up to do first aid training after this campaign, but also the number of men who realised they might not know what to do for their wife, for their daughter, for their neighbour, and they needed more information. And thirdly, it is possible to create much more public awareness about these defibrillators, along with the British Heart Foundation and the Resus Council. This is the circuits, this online map of where defibrillators are. And we've seen, again, lots more people registering devices if they've bought one for a local charity, for example, so that they can be utilised. So it is possible to make a difference on all 3 of those issues. So what might you do over the next year if this resolution is passed? Because actually this conversation is all about getting involved and making something happen. So here's some ideas that you might have started discussing locally or to set your thinking off. I think you can make a difference in 3 specific ways. Personally, thinking about your local organisations and local groups, and nationally. Well, the very first thing to say is, of course, the most important thing you can do is know what to do yourself. So if you are sitting here thinking, well, this is all very well and good, but I feel like a bit of a fraud because I'm not sure I'd know what to do if this happened in front of me, don't worry, you're not alone. That is true for many people across the country. The most important thing you can do is learn the very simple ways to save a life. And particularly, I'd encourage you on those 3 that I mentioned earlier: what to do if someone's having a cardiac event, what to do if someone's choking, and what to do if someone is losing a lot of blood very quickly. There's ways that you can act and save a life, and we can give you confidence to know what to do in a very short period of time, in sort of 5, 10, 15 minutes. So most important thing you can do is that. If you've got a bit more time, look, sign up for a half-day training course, go along for a full-day training course. We've got bespoke training courses that look at what to do if perhaps most of your time is spent caring for elderly parents, what to do if you've got very young children, what to do if you're part of a sports team or you're in the cooking at big charitable events. We can think about how to tailor lots of information for your circumstances if you've got more time. But the most important thing is to act. Excuse me. The second thing you might consider doing individually is to write to your MP. Look, if I give you the statistics to explain that women are less likely to survive a cardiac event than men because people don't intervene, then I think that's outrageous, and we should all be going and talking to our local MPs and councillors. Equally, if you know that your community doesn't have enough public access defibs, then we ought to be talking to local councillors about what can be done. So there's lots of different things that you can just do individually in 10 or 15 minutes, either at home or with a local trainer. So perhaps that's the most important thing. But what might you do in WI groups around the country? Well, before I give you some ideas, it's worth saying that we have 150 different community networks at St John that would be very happy to partner with you on any of these activities. We recognise that training the public is not something that is entirely within our control. Making sure that more people know about this is not something we can do on our own. And so we are always wanting to partner with other local charities to make a difference on this issue. So very happy to connect you in and your individual groups in with your local St John Ambulance group to make a difference. So a couple of ideas of what you might do. Well, the first is you might run an awareness campaign. You might join with us in Save a Life September in your local community, or you might think about Restart a Heart Day, which is always a day in October, that international moment to ask people, do you know what to do to restart a heart? Or we could work with you to create something bespoke, perhaps about the provision of AEDs locally, perhaps about the number of people who are trained or not trained or do or don't know what to do in your local community. There's always opportunities to engage with your local council and with your local media by creating an awareness campaign, simply to ask people, do you know what to do? Would you act if it was a woman, not a man, etc.? And so lots of possibilities simply to raise awareness. The second is to run a training campaign of some kind. We've got lots of very simple products available that our local St John volunteers are very happy to do for free in lots of different settings. So I mentioned earlier this simple way, 3 ways to save a life. Actually, my daughter's learnt that. She's 10 years old. She learnt that in our local park a couple of weeks ago with a St John volunteer. Took 10 minutes and we can come along to local festivals, local gatherings, and offer that as a free offering to the public. Equally, we've got 1-hour-long training courses, we've got 2-hour-long training courses. All of these, our local volunteers are very happy to come in and provide. Ditto, we've got very specific materials for primary school age children and for secondary school children. We've got a complement of materials that can be done and delivered by a teacher in the classroom. They can just download and learn some things online from us and then provide them themselves at a time that suits them. Or some of our local volunteers are willing to come in, do assemblies or small classroom demonstrations, again, to improve people's awareness and do those very basic bits of education. And we're really happy to think about bespoke training or training that might suit particular communities. So if you know perhaps, for example, we were up in Derby this weekend, working with the local Gurdwara and talking to people of the Sikh faith who knew that for them, the way that they communicate with women, the way that they support women in their community is slightly different to the way that some other people do it. And so they wanted a particular package of information so that we could make sure that everyone felt confident to act in a way that would both save someone's life and feel cognizant with their faith. And so we're really willing to work alongside different community groups to think about what might work for you. So have a think. Is there a way in which you could partner with us to train more of the public? Perhaps that's something you're already organising, or perhaps in a particular need or niche that you know exists in your local community. And the third way we can work together is to fundraise together. Fundraise for more AEDs. We know it costs about £1,000 for the actual piece of equipment for the defibrillator, but vitally important is that defibrillator has to be checked. It needs to be checked once a year. The pads need to be replaced if they are used. That's the specific pads that go on your skin. But also someone needs to go and do a kind of pat test. They need to make sure that if this piece of equipment is used, it will be worked. And so actually there's a cost for the defibrillator and a cost for the 10 years of maintaining it. And so raising money for all of that, really important. We know that there aren't enough female mannequins in the UK. There aren't enough mannequins with breasts. And so actually people's likelihood of knowing what to do, of feeling confident chopping the bra off, of feeling confident of where to place the defibrillators if someone has breasts or not, can improve dramatically just by having worked through that scenario with a mannequin. It's really strange, isn't it? The mannequins are called Annies quite often. They were named after a French child. They're named after a little girl, and yet very few of them have breasts. And so really important, we could raise money together for more mannequins that have breasts. They cost about £250 each. And equally, we can raise money to train more people who can train more people. We can raise money for some of the things that we do in communities. But there's lots of different options and ideas for what you might want to think about a local fundraising campaign for. And of course, fundraising, you know this already, but it can be as simple or as complicated as you want. Everything from coffee mornings to gala dinners. And it can be as creative as you want based on big challenge events, running a marathon, etc. Or simply on talking to people about the cause and asking for a donation. So lots of different opportunities to raise money to make a life-saving difference. So then very finally, other things we could do together. Of course, it is possible to work together nationally, and we've been talking behind the scenes about how could you do something that has a big impact? How could you galvanise lots of political support, lots of media support? How could you make a big splash or do something different? Perhaps we should do another version of the CPR bra. Perhaps there should be a day that's just focused on women's health. Perhaps we should talk specifically about health inequalities and that crying shame that if you live in a poorer area, you're less likely to survive a cardiac event because there aren't enough AEDs in your community. So it is possible to campaign together, to join and form a coalition together between our two long-standing charities. So I hope that's given you some ideas, things you might do personally, things you could do in any period of time in your local WI groups, and things that we might be able to do together nationally. There we go. That is the end of my slides. It's been really good to talk to you about this, but I am around, as are various others, to be able to answer any questions or to be able to share other ideas. And I mentioned as I was speaking that we have these 150 different clusters of St John volunteers around the community. And I put my email address down, knowing that my kind assistant behind the scenes will then help me to link up any of you who are part of a local WI group, who want to know who your local St John Ambulance volunteers are, to be able to talk about some of these possibilities, whether you could raise awareness together locally, whether you could do more training together locally and get more members of the public trained, or whether you could raise funds for things like AEDs together locally. Very, very happy to link you up if you want to send an email over. Thanks. Back to you, Chrissy.
Thank you so much, Vicky. As you may imagine, There are quite a few questions already from our ladies, because we are not shy of cutting over the question. And I must say that myself, you're so passionate about all this, and I've learned quite a lot already. And we all think we know, but we don't. So the first question or comment that we've got is from Barbara Bretherton. And this is one which I have heard before, so we would like your answer to this one, please. Barbara says, when our village got its first defib, and that's about 8 years ago, and training, we were told that in many cases defibrillation is not the correct method, and that we should establish this before using the defib. Is this not still the case? Perhaps you might be able to elaborate more on that, please, Vicky.
Great question, Barbara. And to caveat again, I am not a clinical expert. So what I will make sure I do after this meeting is take all of your questions which have any kind of clinical question in them and get the official St John Ambulance clinical advice. I'll tell you what I believe it to be, but I want to make sure that any information you pass out to other people and to the public is spot on. So let me do that for you afterwards. Defibrillation is really important if your heart is not beating in its usual rhythm. And so what is often happening if someone's breathing has stopped is that later their heart will start to fibrillate in a different type of rhythm. But what's vital to know is that if you were to apply a defibrillator, the machine does the work. It assesses what the rhythm is. It assesses whether or not a shock is advised. It assesses whether or not that's the right intervention in that moment. So a defibrillator is not the right answer for every event, but for lots and lots and lots of cardiac events, it absolutely is vital. And so it's really important to find one, to get those pads, get them in the right place, and then let the machine do the work.
Thank you.
Thanks very much. I'm sure Barbara's quite good about that sort of answer. Thanks so much for that, Vicky. Another one we have is that, hang on, we've got Sarah Nuttall. Can we get the slides for our group?
Yes, absolutely. Yep. Yeah, I'll send them over, and they've got lots of references to where the stats have come from and those sort of things in the notes page. So hopefully that'll be useful to you.
I knew the answer would be yes to that, Vicky. So that's an easy one.
Dead easy.
And now this is another one which I thought of when you were actually talking. And this is from Nikki Amos, who actually used to be the public affairs chair before myself. So I'm in a rural area. What do you do if the defibrillator is 5 minutes walk away from the patient?
Great question. So the most important thing to do if someone has stopped breathing is to call 999. And as soon as you call 999, the dispatcher on the phone will help you prioritize your next actions. So actually the dispatcher on the phone will talk to you about, is there someone else around? Could you send someone to go and get the defibrillator whilst you begin pumping the heart yourself? Or could you swap jobs? Could they pump the heart and could you go get the defibrillator? So the dispatcher will help talk you through what the right thing to do is in the right order. Thankfully, it's relatively rare that you might be the only person who is around and available to help, but quite often the dispatcher will ask you, go and knock on a neighbour's door, go and get someone else involved so that we can have a few more hands around and available to help. So it will totally depend on the scenario rather than there being a definitive answer. But if there's multiple people, one person calling the ambulance, one person pumping the heart themselves, and one person going to get that AED so it can be applied as soon as possible is always really important.
So being naive here, Vicky, this is me asking, it's not one of our sensible members. So the defibs are actually, slightly portable, you can deal with it.
Absolutely. Yeah. So most of these, you perhaps will have seen them if you've been into a doctor's waiting room. They're sometimes on the front door, or they're sometimes on the side of the school building, etc. So quite often they are locked behind a glass case. And they'll have a code on them to access, and that is because they're expensive bits of kit, right? They cost between £1,000 and £2,000, and so people don't necessarily want to just leave them on a hook on the side of the building. So sometimes they are, but in most communities they're often behind a glass case. And when you call 999, the dispatcher will be able to give you the specific code to enter. It's often a 4-digit code, you know, the same sort of thing you use to open a gate, etc. Open the box, and out comes this little pack. Right. Very portable, about the size of a handbag, and you can run over to whichever health event it is that you're dealing with. When you open that up, inside, it will start talking to you immediately, and it will tell you to grab hold of the pads. They're flat, they look like bandages effectively. It will tell you where to put those pads on someone's body, and each pad often has a diagram of where to put it. Like, I'm the first pad, make sure you put me on this side. I'm the second pad, make sure you put me down low on this side, etc. And then you press go on the machine, and it starts to analyze the rhythm itself. So the machine is portable and it knows what to do. The key thing you need to do is get it to the person who unfortunately is suffering the cardiac event.
I suppose as well then it would be useful for our communities to know where these defibs are situated, wouldn't it, Nikki, on that, Vicky, on that side of thing? Yeah, absolutely.
And it's a really good way of engaging people, actually, is to say, you know, oh, if something happened to me today, would you know where to go? Have you spotted any nearby? Actually, my kids love spotting them now. You know, easy to spot out the window of a car as you drive past the local town council, as you drive past the local hospital. Where, you know, where are they? Good to have a sense of that, and also to feel assured in your own home. You know, if something was to happen to your spouse, would you know where the nearest one is? Actually, good to know. And you can go onto that circuit. I'll send the link for the website to be able to actually look it up in advance. But also, I think whenever you've had one of these conversations, you start spotting them out in the wild, as it were. You become much more alert to seeing where they might be.
And I suppose the answer there as well is to keep looking, because as you say, and hopefully we are getting more and more defibs around. So where you thought the nearest one was maybe, what, 6 months ago, there may be one nearer to the incident.
Exactly.
By the time it happens. Yeah. Faye, she says, love the bras. Can we get them from St. John's, and can we be part of this campaign?
Yes, well, we are thinking about that for next October. So when we ran this campaign just at the end of last year, we actually made them as prototypes. So they look like sports bras. And as a sports person myself, I have to say they are not particularly supportive in doing the primary function of a bra, which is to be supportive. So they need a bit of work on the actual manufacturing, but they look good, don't they? So yes, we're thinking about, is there a way to manufacture them so that people could buy them? Is there a way to have a t-shirt version? You know, something which allows you to tell a story in public about what you want to do. So we would love to talk to you about that and how to make it possible. It's definitely in our mind's eye for something we could do in the autumn.
Well, I'm a member of another committee on WI, which is the WIE, which runs our shop. And we certainly could do the t-shirts.
Yes, I love that.
So that is an idea I'm going to chat about to our chair of that committee. So that is very good for the future. And that would be, I think once you start with one group and you cascade it to others, it's so good how it much really expands, isn't it, really?
Absolutely. Absolutely. And certainly, this is many years ago now, before my time with St John Ambulance, but about 10 years ago, we worked with Tesco. So as they were manufacturing baby grows, we had a little insert printed on the inside of the baby grow, so where the baby's neck would be, so that as you got it out the drawer, you saw it, and it just said what to do if your child is choking. Really simple, but it goes into mum, dad, carers' minds every time they get the baby grow out the drawer. You just see it where it normally say age 6 to 12 months. Actually, it said, here's what to do if your baby is choking. And so we know that sometimes just putting a product in front of someone, it's a different type of reminder, isn't it, to a campaign or something you might read about on social media or in the local newspaper. So yeah, we'd love to work with you on that.
I really hope that can happen, Vicky. I'm sure it can. It's quite a simple one. Yeah, thanks. Mimi has said the resolution is about debating and who would say no against this topic. I think that's an important question for you to perhaps try and answer for us, Vicky.
Who would say no? Well, I hope nobody. This is, after all, about saving lives, and we know that Health circumstances are sometimes affected by underlying conditions. So sometimes you can predict things a little bit more than others. But actually, this could happen to any one of us. It was only 3 weeks ago in my local park that a toddler started choking on a grape. And due to early intervention, enough people knowing what to do, early access to a defibrillator, etc., actually that child's life was saved. Lots and lots of back blows, lots and lots of attempts to get the item out, but other people choosing to know what to do, to go and run and to get access to different bits of equipment, different people with different levels of training. But that could happen to anyone. And in the same way, a cardiac event, which might stop or change the rhythm of your heart, can happen to all of us in any moment of time. It happens to young and old, it happens to rich and poor, it happens to women and men. And so I think the questioner is right. Who would argue against it? Because it could be you or it could be your loved one. So I'd hope we'd all want to know what to do.
And I suppose the more we learn about different other life-saving, life-threatening incidents, it all helps build up this picture of, it's the confidence, as you said at the beginning, isn't it, of not feeling you can deal with something.
That is a really good point, because often when we start talking about health emergencies and first aid, it can start to feel a bit scary, can't it? It can start to feel like, oh my goodness, anything could happen around any corner, and we don't want you to live your life in fear. Rather, we want to know that you've got the confidence to act if something unfortunate and difficult happens in front of you. And you talked a bit in your resolution wording about bystanders. And actually, it's worth saying that's one of the biggest challenges here is this sort of bystander effect. So first of all, people don't feel confident to know what to do. And then when there's enough people not feeling confident to know what to do, actually people stop acting at all. So we've seen that, unfortunately, in some circumstances, something traumatic has happened on the street in front of people, and there's far more people filming it on their cameras or standing around and looking than there are choosing to make a 999 call, than there are getting down on their hands and knees and trying to do something about it. And but what we want to do is make sure that people don't feel frozen, because I don't think that's a lack of empathy. That people choose not to act, that they become bystanders and passers-by. Actually, it's quite often just not feeling confident. If I do something, could I make it worse? If I do something, could I be sued later? If I do something, could I be accused of inappropriate touching? We want all of that to disappear and for people to feel really confident. I called 999 and I'd started to do something to make a difference. So it is all about making sure that people don't live in fear and worry, but more feel confident that they'd know they could act.
Thanks, Vicky. I think Linda, who's got the next question, has just left, but she will get to know the answer to this. Are there funds or grants available to pay for a local AED and for ongoing maintenance?
Great question. Unfortunately, most local authorities don't provide a fund or a grant locally, and ditto, that isn't what NHS trusts are set up to do. So the vast majority of AEDs are either provided because the establishment fears there might be an event in their location. So, for example, they happen to be in schools or in big public buildings. If you go to an arena or something like that, you're going to find an AED. But they've been purchased by the local charity or by the private business in that circumstance. So actually, we all have to raise money for AEDs. Lots of our own fundraising by our local volunteers locally is to do exactly that, to raise money for the AED. What we often find is that sometimes people might leave money in a will, if sadly, or leave it as part of a legacy for someone who has passed away, which is really brilliant. Rarely do people think about that maintenance part. So there might be the money to provide the actual equipment, but not for someone to go and check it routinely. And so we're trying to do more to make sure that feels like a package when we raise money for it. But yes, rather than accessing funds, sadly, I think we're all going to have to do a bit more fundraising together.
I probably agree with that, but at least it's nice to know that some places will offer this to certain ones, isn't it? Yeah. Anita from Crosspool WI has asked a really good question, which I'm interested in. What are the symptoms experienced by women? And I assume by that she means, are they completely different to what a man might experience?
Yeah, great question. This is a really good example of one where I am outside the scope of my clinical practice. So I will not answer it directly, other than to say, for example, we know that men often experience a certain type of pain on one side of their chest, and women often experience that pain in different ways and in different locations and at different intensities. But I apologize for fudging that answer, but I don't want to give you the wrong bit of information. So I will get my clinician to write up the answer for you and to send it straight away after this meeting, and I'll send it over to you, Chrissy, and you can distribute it.
Thanks very much, Vicky. Another one here, which is very briefly about, can we get CPR bra posters? So I'm sure we'll talk about that when we talk about T-shirts and everything else and what have you, and bras.
Definitely.
Vivian said, are individual WIs able to donate towards the campaigns? As the rules are, we can't donate to national charities. Well, I do have to step in here because we can now donate to national charities, especially if we can show that it actually concerns women and the community, which this does. It's things like, for some reason, animal charities or an individual we cannot donate to. So I'm assuming that you think the same on that, Vicky, or certainly Emma. Emma, do you want to come in on that?
Yes, sorry, Chrissy, I'm just trying to find my camera. Hello, yes, that's correct, Chrissy. I was just going to see if I could find the link. There is some fundraising guidance on my WI. So I'll find the link to that and I'll put it in the chat, and you can refer to that.
So that's a really good question, because I do know a lot of WIs feel they still can't do that, and the rules have been changed by us. I would say, wouldn't you, Emma, about a year, maybe 2 years ago now? Time flies, doesn't it?
Quite a long time. Yeah, but it takes time to disseminate, obviously. But I'm very happy to.
Yeah, sure. Thanks, then, Emma. Margaret's asked, do you need a code for defibrillator from N999 services?
So yeah, some of them you do, lots of them you do, but as soon as you call 999, they will give it to you.
Back to money. How much does a defib cost these days? And that's Barbara from LFWI.
One of these public access defibrillators is somewhere between £1,000 and £2,000. It slightly depends on the box it's going to go into and how often it's likely to be used, etc. But that's the sort of order of magnitude. We think a mannequin, about £250. Training someone who's going to be able to respond. In fact, I've seen some of the names. Some of your members are also St John volunteers. That costs about £350 a year. But I'll give you a long list of things that cost roughly what money, so that you know what sort of things you might set your mind on for. Oh, we'd like this many of this in our local community.
Another question from Carol about T-shirts with the bra pattern on, for those who.
That's a good idea. I'm taking it away, definitely.
That would appeal to us, wouldn't it? That's brilliant. So she's thumbs up to that. Yeah. Tanya from Bowes Bells. My friend survived a cardiac arrest but found it terribly traumatic. She got a lot of help from a charity called Sudden Cardiac Arrest. Is there a list of useful resources, including charities like this?
There are indeed, and actually that's a fantastic additional slide I will add to the presentation. And so there are some for those people who have been the patient, and there are some for those people who may have stepped in, because actually it can be difficult. I've done given resuscitating life-saving support to a number of people, and actually you come away very concerned about them. Did I do everything correctly? What has happened to them, etc. So it's really important to be able to talk that through with someone afterwards. So I'll make sure I include a list of those as an extra slide for you when I send
Thank you. So we've helped you a bit as well, haven't we?
Yeah, it's good.
Sue has just asked as well about diagrams in the defibs, and this is a question probably a lot of us wanted to ask but feel, well, we should know this. I know that AED refers to defibrillators, but what does it actually stand for?
Yes, sorry, I should have spelt it out in my presentation. So the A is for automated, E is for external, and D is for defibrillation. So in a hospital, if you were undergoing surgery, they might do it internally. So you wouldn't have to apply the pads to your skin, which is external, they would do it internally. Defibrillation is that electrical shock that changes the heart's rhythm. And the automated bit is the reassuring bit for all of us. It will not shock the patient unless it needs to. So you can't do it wrong. All you've got to do is get the defibrillator and put it onto the patient. The defibrillator will then do the work.
Anshul and Blowina are saying, thanks for all the questions so far, and we will ensure the slides are available on MyWI, because that's been a recurring question. How can we get hold of those?
Yes,
the team will obviously, if we don't get through all the questions, and we probably will do it. What time were you to finish then, Vicky? Did you, is it 1 o'clock or is it later?
I think it is 1 o'clock. I'm very happy to answer questions a little longer. Keep going.
We're rolling through them, but if we don't manage to get through them all, Vicky will have sight of the questions and we will get the answers to you. Although at the moment, obviously, some people are repeating a similar type of question, which is it's absolutely fine. The slides, we've done that. Angela says, what evidence is available to confirm that people who are got back, in inverted commas, and get to hospital go on to have good outcomes and are not so brain damaged as to survive, but wish they had not? That's a very, very sympathetic, interesting question, isn't it, Vicky? Yeah.
Gosh, really difficult subject, and really good and thoughtful question. I don't have access to that sort of information and literature, and I don't think St John Ambulance does. The thing I would say is that it makes a real difference intervening early. So quite often when you've stopped breathing and when your heart's rhythm has changed, actually the faster someone can act, the better. We saw that statistic about within 3 minutes, because what's happening is that your brain is being starved of oxygen, your heart is not pumping, things are not moving, and your brain is being starved of oxygen. So the longer that happens, the worse your health outcomes can be. And so the earlier you can act, the better. Again, those 3 things, keep them in mind. Call 999, start pumping the heart, and get a defibrillator if it's available. The earlier, the better. But whether or not the specifics of how patients feel after that, I think you'd have to look to the
yeah. But that just shows you how caring the WI is, Vicky, and we're very interested in people. Tanya says, have you worked with the deaf community? They can't ring 999 or hear an AED's instructions.
Really, really good question. Yes, we did a bit of work with the deaf community 2 years ago to provide some of our guides in Braille, but also to be able to think through which bits of first aid would be more or less difficult, depending on whether or not you were hearing or hard of hearing. We've also worked to translate lots of our resources into community languages, so they're available in Urdu and Arabic, etc. But more work needs to be done. And again, that might be a good example of something that you think of in your local community. There might be lots of people who are dual language or English isn't their first language. There might be a specific community, so it might well be people who are deaf, where you think, actually, we ought to do something about this together. This ought to be the focus of our efforts, and we'd love to talk to you and think through with you how we could support specific communities.
Mimi's again asked, do we do the same treatment, I assume, to pregnant ladies?
Great question. I will get you a proper clinical answer before I dare say anything.
Right, okay, moving on. Once again, about where these are situated, Liz has said there may be lists in the local town hall, etc. So there are other places, but I'm sure that we can have this distributed. And as I say, the main key thing is to keep up to date with it, because things will change over a period of time.
Yeah, that's right. That's right. And have a look on the circuit. They show all of them at any given moment.
I suppose, well, with Barbara's next question, it's also key to let people know that they have to look after the defibs. I mean, it's a bit like your car, I suppose, in a way. It doesn't run forever without some attention, does it?
That's right.
Anything in your household. We inspect ours, and there's date stamps on the pads, etc. A bit like a pat test sort of thing, isn't it? We found that in very cold weather, we had to take ours indoors as the charging stopped.
Oh, wow.
Is that a common problem?
It is not one I have heard of before, but gosh, that is, really fascinating. Well, fantastic that you are doing that local maintenance yourselves. As I was saying earlier, it's one of the things we know. Sometimes people struggle to think about how that's going to happen. actually, when someone leaves us a bequest or asks us to put an AED in, we now say we'll only do that where we know we can go and service it, because we want to make sure if someone's gone to use that, it's got to work, hasn't it? It's got to work every single time.
Yeah. Well, I don't go on any longer because it's your time and everybody else, because thank you so much, everybody, for giving up your time today and coming along. But I do really feel it's been absolutely worthwhile, interesting, passionate, and we hope that you've gained something from it as well, Vicky.
I have indeed. Thank you so much for all of your thoughtful questions. They are brilliant insight into the work that you do and into the type of members that you have. So much appreciated.
Yeah.
And there is a really open offer that, you know, this is a life-saving, genuinely issue. And so we would love to help your local groups. We'd love to help each of you on the call to think about what you might do to activate something, some action, whether that's awareness or training or fundraising locally. And to do that in a way that feels appropriate for the needs of your community. And you'll know best. Is that because we haven't got enough AEDs, or because the resources are in the wrong language? Is it because too few people know what to do or feel confident in that moment? Whatever it is for you, we'd love to help. So do get in touch.
Thanks, Vicky, and thanks for sharing all your information and slides. And I would just like to thank the PA team once again, because they've been brilliant at putting this all together. And you, the members, because without you, this would not have been possible. I'd got a list of questions in case anybody didn't put anything in the chat, which I knew I wouldn't need, because our ladies always want to ask more questions. And if there's anything at all, anyone, after the event, you feel that you've thought of another question, please do email the PA team in and we will get it answered for you. But as I say, it will all go on my WI, so you can look back. Use that for people who haven't been able to come along today, but it might be a good recap for some of you that have been as well. So I'd like to wish you all a very good afternoon, and I'll see you very soon. Cheerio, everybody.